A very good morning and welcome to the session 5, chapter 8, Infrastructure. In this chapter, in today's video, we are going to discuss about the health infrastructure. Healthcare infrastructure and various factors associated with it. So in today's class, we are going to discuss about the few topics which is called as health and state of health infrastructure and private sector infrastructure in India. So these will be the three topics: health, state of health infrastructure in India, and private sector health infrastructure in India. So this will be the topic will be covered in today's video. Let us understand few things about the health. How health helps us in building our economy in the country. So let us understand what is health. Health is not only the absence of disease but also the ability to realize one's potential. Simply it tells that we are talking about the performance. See, each and everyone's performance it depends upon how our health is there. So performance is a key factor here. One is able to be normal without any disease and without any problems. And here the second factor is that it is able to work and deliver as per the needs of the country and is able to productive as far as possible, which says that a person is healthy. So, and here health it is a yardstick of one's well-being. Yardstick means it's a measuring rod, measures how the person will perform and what will be his potential. And health is the holistic process related to the overall growth of the development of the nation. So let us understand still more about what are the things we are going to see today. So generally we have reached nearly the 20th century, that is we have come to the 21st century. Now there is a lot of global transformation in human health care has been covered. It may be difficult to define the health status of a nation in terms of a single set. We cannot say that this is what health, but generally scholars assess people health by taking into account some indicators. Some indicators are infant mortality rate. Infant mortality rate means the number of children dying before reaching their first year birthday. So when we look at the infant mortality rate, we will come to know where we are standing in the health in the world. And the next one is by taking the maternal mortality rate. Maternal mortality rate means the number of pregnancy women dies during their delivery time. And the next is life expectancy. Life expectancy is nothing but the lifespan. How many number of years a person is expected to live. In our country, it is nearly 68 years as per the 2011 census. And the next one is nutritional levels. Along with that, also we consider the communicable and non-communicable diseases. So when we consider all these indicators, and we will come to know where we are standing in the health sector in our country. So the development of health infrastructure ensures the country of healthy manpower. That healthy manpower is very important for production of goods and services. And scholars also argue that the people are very much care about their health facilities, and whose responsibility means it is a purely responsibility of the government of our country to make a healthy living. Every human beings, that is the citizens of the country, means they have a right to live and health infrastructure. So what all things and government to ensure the right to healthy living. Health infrastructure will be included, that is hospitals, doctors, nurses and other paramedical professionals, beds, equipments, required in hospitals, and well developed paramedicals industries. These all will help a healthy living. It is also true that only the presence of this health infrastructure is not sufficient to have a healthy people. The same should be accessible to all the people. Now you can take an example in our country. What is the present position of health infrastructure in our country? There is no beds, there is no oxygen supply, and the people are dying on the streets. You people would have watched in the videos and the news and the many newspapers that we are not having a sufficient accessibility to all the people. It's not only that, the same should be accessible to all the people. And initial stages of plant development, policy makers have made sure that no individual should fail to secure medical care, curative and preventive. See, so many vaccines are coming, but still it's not curing the diseases because of the inability to pay for it. Not only that, but are we able to achieve this vision? See, now before understanding this health infrastructure, the state of health infrastructure in the country, we will move towards the state of health infrastructure, which tells the government has the obligation to guide and regulate all health related issues such as medical education, that means medical colleges, nursing colleges and paramedicals, and all this the government has to take a obligation. The government initiation should be to take care of initial construction of health infrastructure and adulteration of food, that is mixing of folly things in the food materials, drugs and poisons, medical profession, vital statistics, mental deficiency and lunacy. So these all includes the health infrastructure in our country. So policy evolved through Central Council of Health and Family Welfare. So in our country we have a separate council for the health department under the ICMR, that is Indian Council for Medical Researches, have been set up in order to take care of health infrastructure in our country, to run the medical colleges and to have a paramedicals, to have the nursing colleges. All that will be taken care by the ICMR. Not only that, the primary health centers has been set up in our country to give the primary facilities for each and every citizen of our country. See, during 1951 to 2013, the number of government hospitals and dispensaries increased in our country from 9,300 to 44,000. So many hospitals have been constructed in our country. That is nearly 70 years of gap. Nearly 34,000 hospitals have been constructed, and the hospital bed facilities from 1.2 to 6.3 lakh bed facilities have been increased. Also the nursing trainers, that is personnel, increased from 0.18 to 23.44 lakh. Not only that, along with the allopathic doctors from 0.62 to 9.2 lakh allopathic doctors have been increased in our country. So the government also concentrating on not only by creating the health infrastructure, along with that it is concentrating to eradicate the small, so expansion in all this primary health centers and number of hospitals, allopathic doctors and nursing trainees and best facilities. It has been resulted in eradicating the smallpox in our country and guinea worm and polio attacks and the leprosy. It has been severely reduced in our country. And next we can have the another example by giving a table, that is state of health infrastructure in our country. So hospitals, you can observe from 1951 it was just 2,694 hospital. As gradually it is increased in 2000 and 2014-15 it has been increased to 19,653 hospitals in our country. And bed facilities 1,17,000 to in 2015 statistics 7,54,724 bed facilities have been increased. But still, due to this COVID, our people are suffering. That is due to lack of beds. You should note that this is not the recent updates, just 2014 and 15. So dispensaries, that is small clinics, 6,600 clinics were there in 1951, and now it is increased to 26,325 clinicals, that is dispensaries. And primary health center, primary health center means the government construct this is what the primary health center. There the major diseases will not be taken care. At the villages, the people should not get without the any medical facilities. The few primary like first aids and few basic facilities should be provided all over the country. That is what the primary health centers. There are primary health centers from 723 to it has been increased to 25,000 primary health centers in our country. Not only that, the sub centers have been started in 1981. Nearly 84,736 sub-centers were established. In 2015, that is 53,655 sub-centers have been increased. And community health center, that is called as CHCs, it has been started in 1981. We had a 761, and 2015 increased to 5,396 community health centers. So this is what the few informations regarding the state of health infrastructure in our country. And in our country, the private sector is playing a very, very major role. So it is having a joint venture along with the public sector. So in recent time, the public health sector has not been so successful in delivering the goods about which we will study more in the next session. So private sector have been grown. Nearly more than 70% of the hospitals in India are run by the private sector. They control nearly 2/5 of the beds available in the hospitals. Not only that, nearly 60% of the dispensaries, that is private clinicals, are run by the private sector. Along with that, the healthcare for 80% of outpatients treatment has been given, and 46% of for inpatients the treatment have been given. So in recent times, the private sector has been playing a dominant role in medical education and training. Wherever you go, wherever we see, why you take our example, whenever we fall sick, that we don't wait for the government hospitals, just we rush into the private sector. So the private sector, where we put private colleges, private institutions, private medical educations. So in the recent time, the private sector is playing a major role in creating the medical education, training, medical technology, diagnostic, manufacture and sale of pharmaceuticals, hospitals, construction and the provision of medical services. So since 1990s, many pharma companies and NRIs, that is non-residentials of India, have established the multi-speciality hospitals in India. Not only that, so in 2001 census, it tells that there were more than 13 lakh medical enterprises employing 22 lakh people in our country. That is more than 80%. More than 80% of them are single person owned and operated by one of the person occasionally employing a hired worker. And scholars also point out that the private sector in India has grown independently without any major regulations. Some private practitioners are there, are not even registered doctors and are also known as quacks. And in our country, do you think many super specialty hospitals and many multi specialty hospitals, so owing to liberalization measures, many non-residents Indians and industrial and paramedicals companies have set up in our country, and to attract India's rich and medical tourists so that they can earn more money. So do you think most people in India can get access to such super specialty hospitals? Whether all are going to the super specialty hospitals? No. Why not? What could be done so that every person in India access a decent quality health care? So government of India has to take lot of initiative in order to create a strong health infrastructure in our country. And this is what about health, state of health infrastructure and private sector infrastructure in our country. Thank you for watching.